So remote patient monitoring is another thing that you mentioned. How far do you think we're going to be able to take that? I mean, what level of acuity are we going to do in the home, and what kind of things do you think will be, I don't know, maybe common in 5 years that we don't see today?
Assuming we're going to move to value-based payment, right? So we have to have value-based payment to move to the home. But I think we have discovered, and we have our Geisinger at Home program that's around for about 3 years. And we have discovered that a very high intensity of services can be rendered in the home. So I think if we move to value, we will move more patients home and prevent those hospitalizations. You know, we're administering IV fluid at home, we're monitoring congestive heart failure at home that 5 years ago would have had a 5-day stay in the hospital with very good outcomes. I think, again, always keeping in mind the total cost of care. I think we have to identify what the value proposition is for remote patient monitoring. Just because we can do something doesn't mean we should. Again, so I think we have to figure out where does it produce the greatest value. And I think the other piece that we can't lose sight of is patient engagement. And that is, you know, a 49-year-old hypertensive doesn't really want to call every day to tell them they have high blood pressure. You know, they may want to know once a week to send in a blood pressure reading, whereas the 70-year-old with uncontrolled hypertension understands that the consequences could be very grave and they may need a heavier touch with monitoring. So I think we have to figure out the right way to engage patients in this valuable tool. And we have to figure out and design programs according to what the patients are telling us. You know, a lot of times in healthcare, we make the mistake of we're all knowing. And in our innovation lab, we insist that we have patients engaged as we design so that we don't believe our own stuff.